Now, if you're planning a big trip and you make a list and you check it twice, you might be skipping something important. Taking time to think about your health. News 5's Jay Jarvis explains why getting medical advice before you take off is just as important as making that itinerary.
Traveling overseas can be safe and fun and a positive experience.
But with all that fun comes some risks.
Illnesses associated with developing countries, tropical countries.
Dr. Keith Armitage, medical director of University Hospital's Roe Green Center for Travel Medicine, says most people get sick while traveling from mosquitoes, food, and water. But if you take precautions, there's no need to worry.
We recommend people come 2 or 3 weeks before they travel. Some of the vaccines take time to take effect. If people come the day before they travel, we can still help them, but in general, 2 or 3 weeks.
The most common vaccine given at the center is hepatitis A, which is very common in developing countries, along with typhoid fever. Dr. Armitage says people who grew up in the United States lack immunity to those viruses, and for those heading to Europe this summer, there's a new warning.
There's a lot of measles in Western Europe. People born between 1957 and around 1980 may not have immunity to measles. The vaccines that were given in the late 50s and 60s and early 70s don't provide prolonged protection.
A pre-travel consultation will run you just shy of $100, and vaccines are estimated between $300 and $500. Dr. Armitage also recommends enrolling in a travel health insurance program. That sounds like a lot of money, but Armitage says it's well worth it.
People can check their policy, but most health insurance doesn't cover you abroad, and especially doesn't cover the expense of getting you back to the United States if you have a serious illness, and that can be tens of thousands of dollars.
Jay Jarvis, News 5.